My name is Jan Vogelsong, and today I will be demonstrating medication administration via mini bag. So the first thing you do is you get the doctor's orders and you read them. I see that my patient today will be receiving Rocephin 1,000 milligrams, which is 1 gram, and the container that we have is actually 500 milligrams per milliliter. It is within date, so he's going to be getting 2 milliliters put into a 100 milliliter bag. This is going to be infused over 30 minutes. The side effects that we're going to be looking for with this patient are swelling, redness, nausea, vomiting, Stevens-Johnson syndrome. The contraindications are aminoglycosides, Coumadin, calcium-containing IV fluids. And the nursing implications associated with this medication are inspect IV site every 15 minutes, check for signs of nausea, vomiting, check for signs of anaphylaxis, rash, and monitor the patient. The drops per minute for this medication is going to be 33 milliliters. So the first thing that I would do is take a syringe after I performed hand hygiene and inject it with 2 milliliters of air so I can get my 2 milliliters of medication. And then I would inject this into my bag. Kind of jostle that around and let it work its way in. I would put my needle into the sharps container, and I'm also going to be labeling my medication bag at this time with the patient's name, the date, the time, and the medication. I'm also going to go ahead and spike my bag with my tubing. Going to take it over here and prime my tubing, making sure that there's no air or anything in it. Prime my chamber and prime my tubing. And I'm going to label my tubing as well because hospitals have policies on when tubing needs to be changed. So at this point, I'm going into the patient's room. Hi, can you tell me your name and date of birth? John Smith, 9/18/77. Okay, Mr. Smith. So today we're going to be giving you Rocephin via mini bag. Your doctor ordered it. Have you had this medication before? He has, so he knows what the deal is. So I'm going to go ahead and hang his bag and his tubing. Do you have any pain or tenderness in your arm going on, Mr. Smith? No? Okay, well that's good. All right, well I'm just going to wash my hands. And then I'm going to put on my gloves so I can inspect it, okay? He's all right with that. Okay, I don't see any redness or swelling. Does this hurt? No? Okay, everything seems fine. So I'm going to take my alcohol swab and I'm going to clean the port. This is to keep it clean. And then I'm going to attach my syringe and I will aspirate after I unclamp it and check for return of blood, which I do see. And then I will inject using the push-pause method. I'm going to inject 3 milliliters. I'm going to do half of a milliliter at a time. Okay, I can disconnect. So at this point, my medication, which has been primed, these ports can be cleaned. This would have an alligator clamp or some sort of cap on it if it was given one. And then I'm going to hook these up. I'm going to make sure this is unclamped. And I'm going to adjust the flow rate, and we were doing 33 drops per minute. Okay. So at this point, I would make sure that my patient knew if he had any adverse effects or nausea, vomiting, started experiencing pain or a rash or itching or anything like that, that he would come and get me. I would take all my sharps and put them in the sharps container and leave the room. Document that he did receive his medication, what medication he received, the amount of fluid that was in the bag with it, and then I would come back into the room when it was done and assess everything. It was still good. I would close this off, clamp it, disconnect. This would either get an alligator clamp or a cap, so it could be used at a later time. And then I would cleanse the port again, take a syringe, and flush 3 milliliters doing the push-pause method just to make sure that it's all cleared out. If there was a doctor's order, this would be the time that I would do heparin, but this one does not have a doctor's order. And I'm done. I would clean up, make sure the patient was okay. I would document the medication, how the patient tolerated it, and